Athletes, please turn off your cameras and only use your first name for privacy reasons. As we get started, if you wish to switch to the speaker view, it's located in the upper right-hand corner of your screen, and then you'll just see this person speaking in a larger view. We'll give it like one more minute, and then we'll get rolling. All right, we're going to get it started. So welcome everybody. To give you the short speech, you guys are muted. If you have any questions, put it in the chat. We'll pass it along. If you're uncomfortable being recorded, we are going to record this and post it to our website. So you can turn off your image and change your name. If you'd like, athletes, we encourage that all of you turn off your cameras and use only your first name for privacy reasons. If you just want to see the speaker, you can switch to the speaker view in the upper right-hand corner of your screen. My name is Vince Caldwell. I'm the newly elected general chair for Lake Erie Swimming. We have quite the array of people on the call today that we're honored to have here. We have most of our board on the call at this moment. So we have our admin vice chair, Kristen McPhail, finance chair, Mark Rudzinski, technical planning chair, Adam Katz, our secretary, Sarah Tobin, treasurer, Diane Finnerty, our senior chair, Eileen Bringman, our age group chair, Aaron Crabtree, our safe sport chair, Sonia Hayward, our operational risk chair, Brandon Burns, our coaches rep, Stacy Aroni and Josh Forsyth, and our athlete reps. Also on the call, I'm very happy to have them from the USA Swimming staff. We have Jay Chambers and Mark Hesse. And two special guests, we have Representative Casey Weinstein and Cuyahoga County Medical Director, Dr. Heidi Gullett. Just a overview of how USA Swimming kind of connects. So across the country, there's about 350,000 swimmers amongst 3,000 clubs. We then take those clubs and break them into 4 zones, east, west, and we're in the central. And that's our zone, is the central zone. We're one of 59 LSCs. And we go all over northern Ohio from, I think, as far as Sandusky down to Massillon and all the way out into western Pennsylvania. And we currently contain 42 teams just in our LSC. So you can kind of see the roadmap of going all the way from the top, all the way down to kind of where we're working at. So just to start, we'd like to begin with updates from our local area. So we'd like to start with the legislative update from Representative Casey Weinstein. If we could unmute him and give him the floor. All right, Casey.
Can you hear me?
Yeah,
hey.
We can hear you now.
All right, can you see me?
Yep.
All right, awesome. Every time I go into Zoom, I know it's really easy, but it's just, I typically screw something up every time. Yeah, Vince, thanks for, so much for having me. I just wanted to introduce myself. It's really cool to see such a great turnout for this. Great to be connected into this community of swimmers and swimming families and swimming supporters. I am the representative for the 37th House District. I live in Hudson, Ohio. Moved up to Hudson in 2013. Just a very quick background. I'm military brat, and then ended up going to the U.S. Air Force Academy, and then was assigned to Wright-Patterson Air Force Base by the Air Force. So that's what brought me to Ohio. I met my wife at the Air Force Academy, and so they assigned me to join her there. And we stayed in Ohio after we got out and done with our military service. And in 2013, moved up to Hudson and was looking to continue public service and found a good outlet for that in city council and was elected to Hudson City Council in 2015. And then 3 years later, elected to the 37th House seat. So it's about Northeast Summit County. Goes as far north as Reminderville and Northfield, and as far south as a gerrymandered slice of Cuyahoga Falls. So that's a little bit about me. I'm on the Armed Services Committee, the Energy and Natural Resources Committee, and Agriculture and Rural Development Committees. When it comes to swimming, I've been a swimmer my whole life. My mom had me in the pool when I was 6 months old. I did youth swimming. I did USSF, I think it was, and I grew up in New Mexico, and I think that was the name of the swimming. It was year-round swimming, and then balanced my time between baseball and swimming going through high school. And I'm very proud of my 15th place showing at the New Mexico High School Swimming Championships in 2000. The times that I went back in the year 2000, I don't think I could have qualified for the state even on the girls' side of swimming today. That's how amazing these young people are, and how far the sport has come since I was really competitively swimming in high school. So it wasn't a Division I quality swimmer by any stretch, but I kept swimming through college, and we had mandated swimming classes that we had to do, and water survival classes at the academy. And then while I was on active duty, I had to keep up certifications for that. And then when I left active duty, I really started to miss swimming, and I joined the Dayton area Sharks swim team and competed for several years in the masters level. And then since we moved up to Hudson, have done a little bit of swimming in groups, but otherwise you can find me every Friday afternoon at a pool in Hudson at Suma Wellness, and I do a workout there. So it's very much a peaceful thing for me, and something that brings a lot of joy in my life, and something that I value. So like you, I've missed it a lot. I think we could all maybe say that on this call, that we've really missed that access to the pool for a variety of reasons, for our family members, or for competition, or for whatever it does for you. So I've tried to take a lead role as much as I can in terms of coordinating with different swimming groups around the state. Really happy to be connected with yours in my geographic footprint too. And I've tried to coordinate with the governor and his team as much as possible, in the Ohio Department of Health, and the different mayors in the area, and the different county agencies that are involved as well, in terms of getting access back to swimming now. And we're having some fits and starts doing that. And if anybody has any questions, I'm happy to address them. But today has actually mostly been about water, whether it's unfortunately flooding, or whether it's access to pools and recreational facilities, and what that's going to look like this summer. That's what I've been focusing on. So I don't want to go on too long. That's a little bit about me. If there are any specific questions, I'm very happy to answer them. You can connect with me directly. I want to make sure to put that out there at Rep Weinstein is our Facebook page. That's my official side page. And you can always direct message us there. If there's any specific issues that come up that I can help you or your organization with, or connect you to resources. So please feel free to connect and engage with us there. But for now, just a really quick update from what most of you are probably wondering. Right now, there are varying degrees of openness with recreational pools. I think most of you have heard that next week, I'm going to get the date wrong. It's the 25th or the 26th, I believe, that pools are opening. There will be limitations on pools. Those are being communicated out. So it's not going to look maybe like our typical summer pool kind of situation, but there will be access to recreational pools. When it comes to competitive swimming and lanes, people swimming in lanes in a more structured environment, and when it also comes to pools in schools, as I have had to say many, many times over the last few days, we are not totally clear yet on what the guidance is going to be for that. And there's also municipal-owned rec centers, of which there are several in my district, Macedonia and Reminderville, for example, in Twinsburg, that have facilities that we're trying to get clarity on access for folks for those as well. So unfortunately, I don't have a lot of concrete answers tonight, but I'm actively engaged with the Ohio Department of Health, and have gone directly to the governor and have gotten the response that he's working on it right now. So we're making some headway. So let me turn it back over. If there are any specific questions, please, I'm happy to answer or address them. I don't know if anything came through or not.
Nothing at this time. Well,
Okay.
thank you so much. We appreciate the update, and please keep us posted and keep fighting for us. We want those pools open when it's safe.
Absolutely will. And again, Rep Weinstein, if anybody has any specific issues or questions, please don't hesitate to reach out. You will get a direct answer, and we'll try to keep you as informed as we can through the contacts I have in the group.
Awesome.
Thanks
Thank you so much.
Yeah.
All right. Next up on our local updates, we have Cuyahoga County Medical Director, Dr. Heidi Gullett.
Hi, thank you all so much. It's great to see all of you today. So Brandon asked me to join tonight for a couple reasons. I'm mostly here as a parent and as a lifelong swimmer myself, but I have two kids, 8 and 11, who swim, and also as a newer official. So I see this from a lot of different angles. Swimming's been a really important part of my life, as you just heard from Casey as well, pretty much my whole life. But my other part of what I do is I'm a family physician, but I'm also a public health and preventive medicine physician. And most of the time, none of you would know that that even exists as a role. But over the past few months, that has actually become a role that most people have learned about. And in that role, I've been the incident commander for our COVID-19 response for Cuyahoga County since our middle of March, when we had our first 3 cases. And so I see this from a lot of different angles, and that's the context I wanted to give you tonight. I'm going to be very brief with what I say and hopefully allow plenty of time for people to ask questions to all of us. But I think it's important for folks to understand that there's a really difficult tension right now between the safety that we all really want for our families and our community and the very real threat that COVID-19 remains. As I left the office just a little bit ago, we're over 2,500 cases just in our jurisdiction. Doesn't even include the city of Cleveland, doesn't even include the surrounding counties of which many of you live in, myself living in Summit County. So, we still have a very real present danger here. This isn't overblown, this is real, but we also all desperately want to get back to our lives. And trust me, nobody wants to go back to my regular life more than me. Our family is, just like yours, been upended, but our jobs have become increasingly more difficult. And so trust me, I want this to be back to normal, but I do feel like it's important for us to be very thoughtful about reopening. And, the safest thing is if we just don't go back and interact with each other, but that's not practical. It's not reasonable. So, Brandon has worked really hard with Operational Risk Committee and many of those folks on this call. And he and I spent time working together earlier this week, looking at guidance from a lot of different sources, trying to take the best clinical evidence we have to be data-driven about responsible ways to reopen. And just because we can reopen doesn't mean that on a specific date we absolutely should reopen, because we need to do this in a way that's safe for all of us. And I think he's done an amazing job of trying to give as much guidance as we can, be very consistent with USA Swimming, be very consistent with CDC and Ohio Department of Health, but also recognize that our communities are desperate to get back to some semblance of normal, and we all want to be active again, and swimming is the way that so many of us love to do that. The other thing I wanted to just say is that it's okay to make choices for your family based on a lot of different things that affect you and your family. So just as organizations, some of you are on this call because you run pools or you run rec centers, you run organizational things, in addition to your role with LESI or USA Swimming. You're going to have to make choices for your organization and your employees and the people, your patrons, the people who come in. Some of you are coaches and you're going to have to make decisions about how you run your practices. We have an infrastructure of some basic guidance, but all of that is dependent on your local context. And so it's also okay to make decisions that you feel like are in the best interest of your organization or your family. And so some families will choose not to return to swimming right now, and that's really fine. And some people will choose to return, and we would want you to make sure that you're taking into account all the safety guidance that your coaches and that your directors give you. And I just really wanted to stress that point, that everybody is going to have a different reaction to how things are reopening. And we just want everybody on the call and all the clubs represented here to have the best evidence-based guidance they can to think about how it is best opening for their own pool, their own club, their own family. So those are the big things that I wanted to sort of set out in my initial guidance, and we're more than happy to talk about more details. But I know, Brandon asked me to keep it short, and which is always hard for me to do. I talk a lot. I talk too much, especially on the radio, and I'm at a meet, right, Brandon? But yeah, some of you work with me are like, yeah, you do talk a lot. But anyway, I'm here. Thank you so much for having me. And I hope that I can provide you as much guidance as is useful here. We in the health department are not in the business of taking away anybody's individual choices. We are simply in the business of giving you the best information to stay safe. And that's really what I care most about. It's all of you and your families and your clubs. And so that we all get through this as quickly as we can and as safely as we can.
Thank you, Heidi. I've gotten a couple questions in the chat, if you don't mind answering a few.
Sure.
The first one I have, I won't use anyone's name. I'll just say that the chat asked, how many people can be in the pool at one time?
So I'm looking at Brandon. Are you going to talk about some of the guidance that we have? Because I think some of these specific questions might be on some of the guidance that we're going to post.
So yes, if folks want to look on Lake Erie Swimming, we do have our recommendations posted that the Operational Risk Committee and in concert with Dr. Heidi Gullett put out. And for capacity in pools, we're recommending folks go back and look at the guidance provided by USA Swimming, depending on the size of your pool, how many lanes you have, so on and so forth.
Awesome. One other question I have from the chat is it safer to be in close proximity to others in the pool than in other public places?
Well, social distancing works. So it's really important to remember the things that do protect us from this. And so social distancing is wherever you are, whether you're in a physical space with someone outside the water or in the water. All I can think of is my 8-year-old, and every time he comes up, there's just a spray of stuff that comes out of his mouth, and he doesn't do it on purpose. It's just what he does, right? So it's not safe for anybody to be right up in the face of a kid who's coming up out of the water, right? We've all seen that. But I think we all just have to recognize that the pool's a different space. So even though the water is got chemicals in it, and Brandon's given some great guidance about the levels of making sure you keep your pools at, and of course that's what a lot of local health departments do, is we keep chemicals in a place. We give you guidance to do that, to make sure you're safe and your people are safe in the water. The social distancing still has to be part of what we do, and that means our coaches need to do that. It means facial coverings are important outside the pool. It means that we really want everyone to be thoughtful about protecting each other from this. We don't want any spread, whether it's in the pool or out of the pool. So I don't think that you can necessarily say it's safer in one location than another. It's safer if you're 6 feet away from somebody, and it's safer if you've got a facial covering on, and it's safer if you're constantly washing your hands and you're really being very thoughtful about what you're touching. And I think that's why you'll see some of the guidance USA Swimming put out around locker rooms not being used and bathrooms being limited and those sorts of things.
Awesome. Thank you. A few more. Now that they know they can ask some questions, it's coming in. This one, you can answer or not. It's okay. This person is wondering when you would feel comfortable sending your own children back to the pool. Again, you're here in a professional capacity, but just a question.
Sure. So I did tell my boss, the health commissioner, I was doing this, but I'm actually not here officially representing the Cuyahoga County Board of Health. And the one thing I would say is I think it's important to, wherever you are, whatever jurisdiction you are, please make friends with your local health department, with the sanitarians, and with your local health department officials. What we really want to do, we are all about prevention. Every single one of us is about prevention. I did an entire residency in public health and prevention. I love nothing more than to prevent infection. So I think all of my colleagues do. So I would encourage you to develop those relationships if you don't already have them. But I did ask Brandon if I could answer this question if it came up, because I fully anticipated it would come up. And my children will not be getting back in the pool anytime soon. My husband is an emergency physician, and I'm a family doc, like I said earlier. I see patients clinically, but I'm also in the public health role. We both see COVID-19 patients literally every single day. And we see the death and destruction that this has wreaked on our community. And I'm not in any way trying to sensationalize anything. I just want people to understand the gravity of the situation. And we've also had kids that have had the systemic inflammatory syndrome that is post-acute, meaning it's a little bit removed from the acute infection. So this is not something that our kids are not going to potentially be sick from as well. So we've made that decision as two physicians who've been on the front lines seeing this, and I had his permission to share our position with you. I'm not telling you what to do for your family, and in the health department, we're not in the business of telling you how to run your pools. We're in the business of, again, giving you the right information. But we had to make a decision for our family. And you have to make a decision if you're a parent or a swimmer on here for your family. And if you're a coach or an administrator, you're going to have to make those decisions for your clubs. So that's just our personal position from where we sit. And also, you know, our kids have particular factors that play into this too. So you have to consider your own medical history, the medical history of those in your family as well.
Great. Will we be able to change in the locker rooms?
So that's in the guidance that Brandon provided and USA Swimming provided as well. Again, we're not here to tell you exactly what to do. We're here to give you the best guidance that we know from a lot of different sources. Of course, USA Swimming, but you know, Brandon and I and others looked at a lot of other sources. And I think the recommendation is to keep the locker rooms closed. Brandon, do you want to add anything else?
Yeah, so our motto is come dressed, leave wet. So you should come in your suit and leave in your suit. We're recommending that coaches limit the locker rooms to restroom facilities only. We prefer that folks use single-use restrooms if possible. And if not, we recommend one swimmer per gender per locker room. And that's because if we could have a monitor in the locker room, of course, that would be the best case scenario, because we all know if we could house more than one swimmer in a locker room. However, kids are kids. And I know at TCAT, we have a hard time with kids in the locker room goofing around. But to balance safe sport with the social distancing and ensuring that folks are safe, we recommend that only one athlete per gender be in their locker room at a time to use the restroom and then come out.
Awesome. All right, one more. Any recommendation for children with asthma?
Yeah, so that's one of those things you have to consider about your own medical history, the medical history of those in your family, of your children, if they're the athlete. You know, we know that this virus is of particular concern for those with chronic lung disease, and that potential for complications is higher. So I think you have to consider that individual risk when you're thinking about whether or not you want to have a different potential exposure. And again, we're trying to give you all the best guidance we can to minimize exposures. What we're all about in public health is limiting new transmission of the infection. And that's the guidance that you're seeing is the best attempt at doing that in the pool, in the sport that we all know and absolutely love. So, you know, I think you have to weigh those risk benefits, and no one can make that decision for you, but we do know that chronic lung disease is a higher risk as well.
All right, I said one more, but now I have one more. They saw the guidelines regarding restrooms. Logistically, how do you envision cleaning between uses if you're going to have multiple people use the restroom in a period of time?
That's totally a Brandon question.
So our guidance is that the locker rooms need to be cleaned every 2 hours. That's our guidance. That's from CDC. That's from ODH. So it may not be something that is cleaned after every use, though, if a facility is looking to try and do that. We are recommending if they can get in and clean surfaces more actively than every 2 hours, we recommend it. So if you have lifeguarding staff that is rotating, and when they rotate down, can go through and clean surfaces such as door handles and stall handles and toilets, so on and so forth, we recommend they do so. Again, if you notice, we do have guidance looking at practices capped at an hour and a half for senior swimmers and junior swimmers at an hour, with the hopes that they'll be able to make sure that cleaning is done at least minimum every 2 hours.
All right, great. Thank you so much. That's all I see on the questions at this point. So thanks for that update. Really appreciate it. So moving on, a few statements from USA Swimming and then some updates. The current state of swimming in our LSC. USA Swimming's priority is the health and safety of all of our members. we're looking to the CDC and local health organizations to lead the way for appropriate return to operations. They're also trying to emphasize that return to practice with slow and safe return to competition. So there's no rush, which leads to some of the things in the future in these updates. So pools are allowed to open in Ohio on May 26th, but it's up to each individual facility and team to determine within the guidelines put out by the governor and the state and the CDC and the ODH when practices begin and what they look like. So I can't provide every answer to that. They will vary based on facility and team and county and so forth. An update on meets. It's a little bit backdated, but all the central zone meets for this summer are canceled. Sectionals, futures, the 14 under championships, open water championships. All of Lake Erie's championship meets are canceled, and current summer meets are postponed due to USA Swimming not allowing sanctions at this time. USA Swimming's national meets are canceled with a potential for regional meets. They're thinking about 17 regional meets for sectional and above level swimmers sometime in August or September. This is still very tentative and depends on local and state reopening conditions. So nothing concrete yet, but just an update about their thoughts on competition. They're not intended to be some type of regional championship, but rather a reintroduction to competition for some higher level swimmers. Next, I just want to make sure we highlighted some of the support that USA Swimming is putting out there. It's quite a list, and there's a lot out there that people may not know of. All of these things are going to be in a link that I believe Pam has already put on the Lake Erie Swimming homepage. But just a quick rundown. The greatest one that I found and the number one on the list is the USA Swimming Community COVID-19 resource page. So right on their homepage, right on the top, community resource page has been fantastic. It has the webinars and podcasts, club operations information, mental health resources, and the USA Swimming Leadership virtual town hall meeting. So the national board got together, recorded a 30-minute virtual town hall that we also posted to our homepage of our website that kind of addresses some of the higher level things at the national level. They also have a return to competition roadmap that just came out. So it gives you some guidelines for June and July. That's great for teams and anyone else who wants to look at it, kind of some ideas of how we'll get back to competition in August or September, or even what we can do in June and July to do something competitive. There's a facility reopening and return to practice plan. It contains requirements, recommendations, and areas of concern that coaches and teams must consider as they develop their facility use plan. I know currently as a coach, we're putting things together like that and working with our facilities. So that's a great resource to have. They have the OSHA guidelines, the White House guidelines, the CDC youth program and camps decision tree for reopening, sample return to practice plans, a learn to swim return plan from the United States Swim School Association and USA Swimming. And it has another webinar on there, the then and now of pool operation and programming adaptations. So you can go on there and check that out. There's open water resources, so safety management of open water workouts and how to structure your open water workouts. I know some people are maybe doing that for the first time because they have a lake that they can access and stay socially distanced. So there's some guidelines for that if you've never done it before, if you're looking to make it better. There's also a webinar along with that, best practices and strategies for open water workouts. That's actually going to be tomorrow at noon Eastern, so you can check that out. May's Water National Safety Awareness Month. So there's general information for promoting water safety through the USA Swimming Foundation and printable materials through the foundation as you go through it, just to prevent or to give you more information on water safety awareness. Some updates, USA Swimming membership changes. So at the April 24th USA Swimming Board of Directors meeting, the board approved the following changes regarding membership. So individuals applying for calendar year membership on or after June 1st, 2020 will receive membership valid through December 31st, 2021. So essentially our 2021 registration period will start June 1st. Changes to the Flex membership that were approved in January, it was a slight increase and some changes. It has been delayed. The implementation has been delayed from September of 2020 until the 2020 membership year, or until 2021, which will be the 2022 membership year. So we got a while until those come into effect. And they've extended the seasonal memberships through August. There's Technique Tuesday webinars with Russell Mark. Personally, these have been fantastic. They've already had 3 of them. They are posted online. But every Tuesday at 1 o'clock, he does a half hour on the 4 strokes. This coming Tuesday is on freestyle. He's already done flyback and breast. There's Safe Sports Zoom training. So this is available to everyone. So athletes, parents, and coaches can now attend a training session conducted by USA Swimming's Safe Sports staff via Zoom. The parent and athlete meetings will count towards the requirement to become a safe sport recognized club. USA Swimming Safe Sports staff will record attendance and manually update the club portal. They do limit these at 500, and they've been filling up quite quickly, so they recommend logging in 15 minutes before. Parents, they have the webinar every day from 3 to 4 Eastern. Athletes, they recommend ages 12 to 18 attend. Younger than that, you might want a parent there, or it may not be 100% appropriate to do on their own. Is every Thursday from 3 to 4 p.m. And then coaches is every Friday from 3 to 4 p.m. So that can fulfill your safe sport requirements. They're sharing the Swim Biz. That was normally a conference, but they're doing it as a webinar series. Every Tuesday and Thursday at 2 o'clock Eastern time. They've been putting out a webinar that have been really, really helpful in terms of how to manage the marketing and communications in swimming. They're in the middle of a Building Connections Coach and Team Leadership webinar series. There's a lot of webinars. So far, they've had 2, and there's 2 more. Again, all of these are posted inside the webinar section, and you can go back and watch them if you're busy in Zoom meetings all day already. The US Swimathons. The USA Swimming Foundation is committed to defer their 5% share of Swimathon proceeds in 2020 and 2021 back to the local participating clubs in order to let them use that as a greater fundraising opportunity. One of the things I think is really cool, the 2016 Rio Olympic Finals race videos. They have gotten the permission from the USOPC to access the YouTube channel for 2016 Olympic footage for educational purposes. So your coaches can access that to do race analysis, keep athletes excited about the sport, or other virtual educational opportunities with the team. So that's really cool. There's a free enterprise Zoom license. I know a lot of teams have utilized this already, but as teams have been trying to stay connected with their athletes, if you need help getting a Zoom license for your team, please check that out and contact Paula D'Amico, and she can help set up teams. They've released the Last Gold movie, which is free of charge. It's about the 1976 women's Olympic team who were competing against the doped East German athletes in an amazing relay. So you can view that by visiting it, and it contains a password. So if you go to the link that was posted, you can find that there. 3 more. USA Swimming COVID-19 relief program for teams. So teams have been able to apply and receive up to $5,000 worth of a relief grant. From what I've heard, they should have those teams that applied. You should be hearing by the end of the week was their goal. So check that out. Coach certification extensions. So as a result of closures of many facilities, coaches can find it difficult to renew some of their certifications. So there's a 120-day extension from the Red Cross. So coaches, if you have some things coming up, please click on the link and find more information. And the last one, they're working with One America to do some informational services. So they use them for financial services to offer education and resources to help you navigate budgeting, dealing with market volatility, and offering financial advisors. So if any teams are interested in that, check out the link. That's all I had on all of those. I know that was a lot, but we do have Mark Hesse and Jay Chambers. If you guys have anything to add to what is coming kind of from the national level, this is your time.
Thanks, Vince. Yeah, I think you hit on all the major resources. Obviously, there's so much going on in the Zoom and webinar space right now, and we want to continue to offer opportunities for athletes and coaches and parents to get education through that space. So do encourage you to check out those listings on the COVID quarantine page. And then every Monday, Randy Julian, who is your Central Zone program development manager, the two of us are doing a kind of coaches roundtable with any of the coaches in Lake Erie who want to join us, just to talk about where they are, issues they're facing, and share ideas on that. So that's been something that's been ongoing from pretty early on. I just want to reemphasize the points that were made earlier, that our number one priority is going to be the health and safety of our athletes, coaches, and officials, and obviously families are included in that, and that's going to be our priority. And that's why we are recommending a slow and patient return to the water. And I don't think any of us really anticipated how uneven it would be across the country in terms of timelines. But that's the situation we're all in now. And as far as return to practice, that really is governed by a couple things: your state governor's process for reopening, and then beyond that, any local or municipal rules on reopening or restrictions on reopening. And then it will be up to the facilities and the clubs to create a plan that they feel is safe and accounts for all the health considerations in returning. Just want to encourage folks not to expect normal swim practice when the first return happens. And normal swim practice will return at some point. We don't know when, right? Because we are really right now, playing that game with how do we contain community spread and get back to some normalcy. And I think the CDC today put out some guidelines on youth sports, and they were very clear in their recommendations of what they consider low risk, medium risk, high risk, and certainly competitions are in the high risk area. So we're taking a wait and see approach on that. We're anticipating in mid-June to make a decision on July, and our hope is that enough programs will be back in the water and practicing safely that we will open up sanctions for virtual meets, for intra-squad meets, and then progressing possibly to dual meets with another local team. And then the next step would be a smaller invitational type competition. We don't have an exact timeline for that. As Vince mentioned, we're hopeful to be able to offer some regional level competition for our upper level senior swimmers at the sectional level and above. but that really is out there as a hope for us right now. We continue to plan for that, but we obviously have to respond to changes in guidelines as we get closer to that date. And that's really all the updates I have. I'm happy to take questions on what USA Swimming has done, or if you want to save those towards the end. Vince, that's up to you.
Yeah, I don't see anything specific to USA Swimming. Oh, I know this one's been asked during some of our meetings before, and you might be able to help. Do you have any information or evidence showing that COVID-19 virus can be killed in the pool with the chemicals being used?
You know, all we have is the information from the CDC that says there's no evidence of transmission through the pool water. So once the virus is in the pool water, within a period of time, the chlorine concentration in the pool, assuming it's appropriately maintained, will kill the virus. So again, no evidence of transmission through the pool water. Obviously, areas of concern would be when the swimmers are on the wall, when the swimmers are entering the facility, leaving the facility, and then as has already been discussed, the locker rooms and things like that. So we're still, all of us need to be vigilant on the social distancing piece of it, and that will create a limitation of the number of athletes that can be in any one practice group at this time. As those restrictions and social distancing recommendations are adjusted and loosened, hopefully, then we'll see the opportunity to have more athletes in and possibly, you know, some more of the traditional practice setups that we're all used to. But it really is a waiting game, looking for guidance from the experts. I think it was wonderful that Dr. Gullett was on here to talk to all of us and give us her perspective on it. I think relying on the health professionals right now is our best bet, and just being smart.
And Vince, I just wanted to add one thing in regards to the pool, and Mark had mentioned it, a well-maintained pool. And so you'll see on the guidance as well, recommendations to keep your pools at 1.5 or a little bit higher. We know that there's some evidence that shows that the chlorine at 1.0 deactivates. Remember, a virus is not alive, so it can't be killed, but it's deactivated at 1.0. But the levels can fluctuate, and for a variety of reasons. So if you keep your pool at the minimum 1.0, there is a chance that it could fluctuate below that. So that is why we were recommending that facilities keep it at a higher 1.5, and also recommending that coaches go beyond the minimum testing and test before every swim practice.
That's a great point, Brandon, and I did misspeak on terms of killing the virus, right? Inactivating it. And that takes us to the open water concept of training, right? We need to make sure that the bodies of water that we're choosing to do open water training in are approved for recreational use and are being tested on a regular basis to make sure they're safe. COVID-19 is not the only waterborne virus or bacteria that can be present in an open water situation. So we do encourage, again, smart thinking and proper precautions on that. As Vince mentioned, webinar tomorrow morning on that. several documents on the USA Swimming website about open water safety.
All right, I got a couple as we were going through. First to come in was, what is the legal obligation if a swimmer were to contract COVID-19? Is having a hold harmless or release waiver suggested? And are we covered under USA Swimming insurance during this time period?
So there's very little information as far as the liability piece surrounding virus contraction. The member insurance that athletes have through USA Swimming is a secondary accident and injury policy. So it does not cover illness. So in that sense, the athletes are not covered under USA Swimming insurance. As far as using waivers and that type of thing, I think waivers are great for informational purposes and educational purposes for athletes and parents. We do encourage you to consult a local lawyer to get guidance on what type of waivers would be effective in the state of Ohio and would be appropriate in the state of Ohio, because that type of liability law is all covered by state statutes. That's our recommendation. If you want to have a waiver, I think it's a good idea. But I can't vouch for what type of protection is going to offer to the team for that.
Thanks. Heidi, you had something to add on this topic? Oh, I got it unmute.
Perfect. Thanks.
Oh, there we go.
Yeah. I just wanted to add that I just wanted to briefly explain what would occur if there was a positive case. So if there is a positive case, that individual case, whether it's a child or whether it's an adult, would be contacted by the local health department. And the notifications come through the provider who ordered the test, but also through the lab to that local health department. So say you were swimming in a suburb of Cleveland and you would be in the jurisdiction of my health department, we would be notified and we would call the parent if it's a child, or if it's an adult, we would call that person. We would have a case interview with them. It's pretty detailed. And part of that is we understand what kind of contacts you had within 48 hours prior to developing symptoms. And so if you had an athlete or a coach who was at practice, we would talk about what exactly that looked like and what exactly those contacts were, which is why social distancing is so important. Because if you're socially distanced, then those wouldn't be contacts. If you're wearing a cloth facial covering, then that really reduces the risk you give to someone else. So I just wanted people to understand that, a lot of times people get really fearful, like if I was in the same gymnasium as somebody across the way that I could have it, but really we do think it is a lot closer within that 6-foot area for a period of time, probably 15 minutes or more. So if you were to be identified, or your athlete was to be identified as a contact of a positive case, once we get back to practice, you would be called by that local health department, and we would explain what that what that means for you and what a quarantine means, et cetera. So I just wanted people to have a general sense. You hear a lot about it on the news, but I think there's a lot of misconceptions about what it means and how you would be contacted. But we're really, really careful about getting everybody contacted who's potentially exposed and at risk for the infection.
And I think that's one recommendation that is important for teams to consider, is keeping track of attendance and what athletes were in which lanes and that type of thing for the foreseeable future. I know I feel pretty strongly that you should have a practice group that is stable and consistent, so that you're not mixing kids from multiple practice groups, because then the contact tracing becomes much more difficult, and the potential for community spread becomes greater. And that's something we've discussed with the coaches regarding kind of the best practices and ideas on running a practice. So having great record keeping, which should be relatively easy considering the smaller numbers in practice, at least in these initial phases of return.
Couple more. Mark, I don't know if this was from you guys or if this was from Lake Erie, and Brandon, if you want to take it, but the rationale behind not recommending snorkels be used at a practice.
So Heidi, I don't know if we can unmute Heidi. I think she'd be, and that came from Lake Erie Swimming. I'm not sure if it's a recommendation from USA Swimming. I don't remember it being one, but Heidi, do you want to?
Yeah, so when we were talking through guidance, again, this is going to be phased. So I think the safer we can be at the beginning, the more conservative we can be at the beginning, the better. This is, again, about keeping everybody safe and taking away any risk of transmission. The same with our water bottle guidance. We were trying to be really careful about ways that we, kids share things. So the recommendations are really, again, these are just recommendations. You do what you need to do for your club. But the thought is that if you're sharing equipment, I mean, we all know where all of our kids' pieces of equipment land and how they touch each other. And, I think earlier Mark was talking about the risks at the walls. I mean, we're really trying to think of every potential risk for transmission of infection, and we're not trying to make people crazy at all. Trust me. I was coach, I get it, but we also have to think about where spit is going to be and where exchanges of aerosolized virus is. So those were the recommendations initially, to be as conservative as possible, but and so not to share equipment, not to have a big bin of equipment the kids can get out of, and then also to try to minimize anything where secretions would be on there and then somebody else touches it, they take it out of the water and someone else puts their hand down in it, that sort of thing. The same with sort of separating water bottles and putting them in a defined area and making sure kids aren't over there at the same time, using them. So those are just some things we thought would be helpful for folks.
All right, one more. Is it recommended to wear masks while outside of the pool before you get in?
Yeah.
I would agree with what Heidi's saying. I think that most of the teams that we've seen go back to practice, there is in other parts of the country, there is an expectation that the athletes wear masks coming into the facility and exiting the facility, and also the coaches are wearing masks at least when they are within close proximity. When the athletes are swimming and the coach is standing up there, away from them, or possibly giving instructions, from a far enough distance away, having the mask off for that point. But anytime there's any type of contact, we do recommend that masks are worn. And I think that's just pretty consistent. It's not a mandate that we're making, but it is a recommendation. And I think if teams wanted to mandate it, that's your right as a private organization to do that.
Vince, can I just add one more thing? So, there are parts of the country where there's been a lot more virus activity. In Ohio, our governor and our Ohio Department of Health director really put things in place very early. And so people adhered to that, which was amazing, and they stayed at home. But the flip side of that is that we have a very low percentage of our population that's been exposed to this virus, which has kept people safe. It kept us below surge capacity. It kept our fatalities. We've had a ton of fatalities, but it kept it a lot lower than in other parts of the country where that was a lot worse. But the issue is that we don't have a lot of people with immunity. A lot of people haven't been exposed. So because of that, you have to think about how many people could be potentially exposed and be vectors of infection. And a lot of kids are doing okay, but then they go spread it back home and they go spread it to other people in their lives. And so part of the mask is also about protecting the other people and making sure that you're not transmitting at practice, but also other parts of your life where you're being exposed. So we know that in like New York, for example, there might be 25% of folks may have been exposed. Herd immunity doesn't kick in until a whole lot higher than that. So we just know we have a whole lot of folks who are potentially exposed. And so these extra added things are really just low impact ways to protect each other.
Great. All right, thanks guys. This one I guess doesn't have to go to the whole group. I think this would go more towards Brandon or Dr. Gullett. Does the 2-hour cleaning period include starting blocks? And if so, is there a solution that you recommend using with the different, surface?
So any surface that is going to be touched by the athletes needs to be cleaned every 2 hours. In regards to a chemical solution, there are many out there. I don't want to say many, but there's some different options out there. I recommend just going through your facility or going through your local company that you purchase chemicals from, asking for solutions that are known and rated to deactivate the virus and use that. But yes, any surface that will be touched in the practice needs to be cleaned every 2 hours at minimum.
There are a lot of good EPA approved COVID-19 cleaning supply lists. We have one on our website, but there are plenty of others. Just Google it. ODH has one on their website too.
And if you go to the USA Swimming site, the webinar that Vince referenced, the then and now of pool operations, you don't have to watch the whole webinar. If you just want to download the presentation on there, there is an extensive list of products that that are safe to use around a pool and recommended for use around the pool, as well as a list of some products to be sure not to use around the pool because of the dangers of mixing chemicals and things like that. So I would encourage you to, yeah, encourage you to check that out on the USA Swimming webinar page.
All right, great. Thanks, guys. Next on our agenda, we have Mark Krzyzewski, our finance chair, to discuss the financial support that Lake Erie Swimming is providing and offering to clubs. Mark. Floor is yours.
All right. Well, guys, Lake Erie is offering a match loan program for just to help out the association through these financially challenging times. So the application is on the website. My cell phone number is on the website, so certainly feel free to reach out to me. But basically how it's going to work is hopefully, those in need had applied to the grant through USA Swimming. Once that grant gets, you get approved, which I think from what Vince is saying, you probably should hear something back, hopefully by Friday. The amount of the loan, so we're offering a loan up to 50% of the approved USA Swimming grant awarded. That amount awarded through Lake Erie Swimming will be limited to $1,500. The deadline for this application will be Friday the 22nd. The interest rate on that loan is a 0% interest rate. So, and then the payment program would be 9 monthly payments, and that would not start until January of 2021. So kind of long and short is once you receive your grant, I would highly recommend either going onto the website or calling me. I could walk you through the application process, and then the Lake Erie board will look at the loan process and again, award up to $1,500 interest-free loan. That's really it. Very simple. Shouldn't take you more than 15 minutes on the application.
Awesome. Thanks, Mark. Next would be Brandon. Any highlights on our return to operations that you'd like to put out there? I know everything's been posted on the website, but anything you'd like to really highlight here?
No, just really to keep folks informed and let them know that we have been actively working on this. Not only the operational risk committee, but then also we did have a separate COVID restart task force as well. So just letting folks know that we're keeping up to date with all of the guidance, reaching out to experts, including Dr. Gullett, who luckily is in the family, and trying to provide the best recommendations that we can for folks. We understand that this is a hard process. Some of the guidelines come out and they don't necessarily translate into swimming operations. So we've been doing our best to take the guidance, take the information from many different sources, and provide some quick step checklists that coaches can go through to make sure that they're safe to return. I think one of our next goals is start looking at competition if and when that becomes available. We have some ideas, but again, we're going to wait until we see how this progresses before we start trying to put any recommendations out there.
One question for you, Brandon, that came in. Will there only be one swimmer per lane at a time at my practice?
So again, we would recommend that folks go back and look at the guidance provided by USA Swimming in regards to the amount of participants, how they're spaced, depending on the pool size and the amount of lanes they have.
Awesome. Thank you. Pam, anything on registration?
I just want to reiterate what Vince had said earlier. Usually registration year starts September 1st. They've moved that back, USA Swimming, to June 1st. If you have a current 2020 year-round registration, it will be good until December 31st, 2020. If you get a 2021 registration, which will start June 1st, it will be good until December 31st, 2021. The club registrars will be getting more information in the next week on this. The 2021 form has been posted to the Lake Erie website under forms. So contact your club registrar for further information regarding registration. That's it.
Great, thanks, Pam. One question that just came in, and I'll address it, is, well, unless Jay would like to jump on it, will there possibly be a phase 2 on the USA Swimming grant? Everything that I've heard is they have an intention of doing a second one when we get closer to a return to the normalcy, with a different intention, maybe towards marketing budgets or something like that. There's not too much about it, but they have discussed a phase 2 of grants for teams. They haven't given the specifics of that at this time. I think they were trying to get through phase 1 before we got into a phase 2 yet specifically. From there, Pam, I'll ask you to